Hey guys, good day. My name is Martina. I'm a student nurse from Our Lady of Fatima University, and joining me here today, I have my classmates.
Hi everyone, I'm Matthew Hernandez. I am a second year student nurse from Our Lady of Fatima University.
And I'm Lawrence Ko from Our Lady of Fatima University as well.
Yeah, so for this podcast, we're gonna be talking about this so-called walking pneumonia. And before we start this program, alam nyo ba guys na we have some of our schoolmates and they had this interview with some of the Fatimanians din.
Yes.
Narinig niyo ba yan?
Kami nga.
Well, it was good to note that they have an understanding about the illness that is currently circulating, not just in the Philippines, but in some parts of the world as
Yeah.
well. So, alam mo yun, as student nurses or as nurses in the future, hopefully, it is very important na dapat maalam tayo with societal, what is happening in our society. And at the
right.
same time, katulad na to, this is a medical one, this is concerning about the health. So, dapat alam natin to na, alam mo yun, ma-educate din natin yung mga tao kasi it is part of our job and it's also very inclined with our career na dapat alam talaga natin yung mga gantong health issues.
That's right.
Well, according to a backtrack here, recently Chinese authority reported that there are yung number of children na may sakit sa respiratory illness is tumataas and it's spreaded through European countries as well.
Yeah, I think I read about that the last month, di ba?
You're right actually. From December 6, if I'm not mistaken, and according to the Department of Health, it starts from January to November of this year.
Okay.
And yung case ng apat yun, and gumaling na sila actually.
So ayun, right partner, the DOH said that this illness is not new. It is said that this is caused by a pathogen called Mycoplasma pneumonia.
So, ayun yung pathogen niya.
So the health department explained that this pathogen causes various infections such as cold and pneumonia.
Yeah, I think I read about that too. And some of the symptoms are fever, dry cough, and sore throat din. Parang sa COVID, di ba?
Totoo.
Very COVID-like. And also, guys, they quoted here na while all age groups can be affected with those with weak immune system and living in close setting are higher risk for more severe diseases. So, yeah.
Actually guys, yung itong news na to ay kumakalat sa public. For example, here Facebook platform and sa mga social media kung mapapansin nyo, nagbabatuan sila ng mga yung concern nila or advices here
Yeah.
about sa walking pneumonia.
Usually sa comment section, di ba?
Oo. Sa
Tapos-
So,
TikTok,
dun sila
marami
nagka-
yun.
Yun nga, very rampant siya kayo sa TikTok na nagka-clash pa nga sila sa comment.
True.
When it comes to advices about this kind, but it is good na dapat, alam mo yun, nagbigay sila ng advices and also, alam mo yun, tawag dito, aware sila with the issue itself. So, alam mo yun, lagi nilang sinasabi,
Yeah.
like most people
Yeah.
sabihin nila, there are disadvantages as advantages social media. So,
True.
this kind of information, yung pag-spread ng gantong information, this is what we call yung advantage talaga ng social media.
True.
Okay.
Well, I'm not gonna be surprised kasi expected na to since we've come through COVID-19, diba? And the symptoms are very similar from this walking pneumonia. So, yeah, some of our COVID-19 health allied people, they expect us to do like proper ways on how we can prevent this one din, diba? Para hindi na tayo like ma-lockdown again.
Oo.
Some
Alam mo,
sort
if
of-
there's one lesson that I've learned talaga during the pandemic is that, alam mo yun, alam mo yun, very normal kasi talaga na nakaka-experience tayo ng ganyung
True.
symptoms like yung cold, cough,
Yeah.
mga yan. It's very
Same na
common.
same
So, dapat hindi
symptoms.
natin siya ini-ignore and pinapatagal kasi it may be,
That's right.
tawag dito, there might be an underlying condition behind this symptom.
Yeah.
So, dapat talaga, nag-iingat tayo and at the same time, nagpa-check up talaga tayo.
Correct.
Yep, and furthermore, according to the Department of Health in the Philippines, dapat daw yung mga healthcare professionals should be under-trained and
Yeah.
dapat yung mga hospital dapat fully equipped.
Yeah. And don't forget that our hospitals, we have enough supply when it comes to this, scenario again. Para prepare na tayo. What can you say about that?
It's somewhat agree na dapat talaga naman talaga prepared tayo and meron tayong enough supplies. Pero kasi, alam mo yun, from my experience as a student nurse
yeah.
na nag-duty na rin with
Yeah.
hospitals,
Okay.
yung mga public hospitals here in the Philippines, they
Hindi
are,
Hindi
bukod
na
sa
supply.
understaffed sila, alam mo yun, hindi enough yung mga services na available para sa mga
Yeah,
tao. And
medyo
knowing,
agree on that.
knowing the Philippines itself, it is a third world country, so mas marami ang mahirap. Mas marami ang nagre-rely sa public hospitals.
Yeah.
And alam mo yun, based on my experience, there are patients na kailangan nila mag-avail ng ganitong services kasi hindi available sa hospital na yun. And alam mo yun, they tend to ignore na magpatingin or magpa-check up to other, alam mo yun, sa other hospitals, sa private hospitals kasi sa kakulangan ng pera.
Pero
So,
mas mahal.
nai-ignore na nila, nasa-set aside na nila. So, lumalala yung condition nila. So, it
Mm.
is best talaga na dapat yung Philippine government, it should strengthen and
Yeah.
yung quality ng healthcare system dito sa bansa natin.
Actually, I agree with that partner. It seems like we really learned from the past years during pandemic, and we
True,
should
from
really
COVID-19
read it.
talaga.
Mm.
So, well, if we're gonna talk about the prevention, what can you guys say about it?
Hand washing.
Hand washing talaga, di
Hand
ba?
washing talaga.
Alam mo, totoo yan. Alam mo, kung titingnan, kung iisipin natin, itong pag-hand washing, sobrang simple lang naman na to. No? But
Yeah.
in the simplest ways, malaki yung effect niya.
True.
Na alam mo yon kasi yung paghuhugas ng kamay, very important niya kasi we use our hands in our daily lives. Like almost everything that we do is, you know,
Yeah.
kung ano-ano yung hinahawakan natin. And sa lahat naman ng hinahawakan natin, may mga bacteria dyan, may mga
Mm.
pathogen siya. And hindi naman natin maiiwasan na hindi hawakan yung kamay natin.
Yeah.
Alam mo, hawakan yung ilong natin.
Yeah.
And yung paghawak natin na to sa bibig, sa mukha natin, sa ilong natin,
So,
nai-inhale natin
yeah.
itong mga bacteria
And
na to.
hindi-
Yun yung nagkukos ng infection.
True.
Okay.
And if hindi naman available yung hand washing, we have alcohols and sanitizers, di ba?
Oo. So it
Mas
is very
convenient.
wow, it is important talaga na dapat malinis lagi yung kami natin kasi in
True.
these little ways talaga mape-prevent natin yung pag-spread ng infection itself.
Kumbaga,
Yeah.
yung hand washing, simple lang siya, but it help us a lot.
Oo,
True.
totoo.
True
Okay.
with that. So,
And of course, according to here, yung pagsuot ng face mask is very advisable pa rin.
yeah, face mask din.
Mm-mm. Kasi yung paddles na yun, pag na-inhale natin yun during our talking, laughing, kaya siya mag-cause ng walking pneumonia, I guess.
Alam mo yun, yung pneumonia itself is, alam mo yun, nakukuha natin yun through inhalation
Yeah. It's
ng mga
airborne.
ng bacteria, ganyan.
Okay.
And one
Correct.
thing is, yun nga, yung prevention, dapat hindi tayo lagi na sa
True.
congested areas. Kasi
True.
aside na mas marami may infect, mas mabilis yung pag-spread ng infection kasi pag nasa
Yeah.
congested areas tayo. And kung hindi naman maiiwasan, which is always naman talaga dapat kahit naman wala tayo sa congested areas, dapat nag-face mask pa rin tayo. Kasi the greatest lesson that I've learned from the pandemic, that
Yeah.
prevention is always better than cure.
Cure. That's
Kasi,
right.
alam mo yun, it might be too cliche, pero mas maganda yung ma-prevent natin
True.
siya. Kasi mas madaling mag-prevent kaysa maggamot. Alam mo
Tama,
yun?
tama. So, yeah, I think one of the most important then is if we're gonna have proper ventilation. So I think we reached the end of our discussion.
Oo.
And what can you say about our viewers then?
So, our viewers, I hope you will learn a lot. I hope na-educate namin kayo when it comes to the pneumonia and how we can also help in our own little ways to prevent the infection itself or the virus itself.
For me, may papayo ko lang is always wash your hands and wear face mask.
Yeah. And boost your immune system, guys. If available ang vaccination sa inyo, get vaccinated.
And it's very important na dapat kumpleto and lagi tayo nagpapabakuna. Kasi, alam mo yun, it is the most effective way para ma-fight natin yung mga gantong klase ng health issues.
That's right. So, thank you so much for listening in our podcast. Again, my name is Martina.
I am Matthew.
And I'm Lawrence. Thank you for joining us.
Bye.